ሴቶችን ባሮችን ከበደልን ከመርገምም ሁሉ አድናቸው። በቃላችን እንዲሆን በሥራችን እንዲሆን በሀሳባችን እንዲሆን አቤቱ አንተን ስንበድል ተውልን፣ አስተሰርይልን፣ አስታድልን። ከበደለን አምላካችን እግዚአብሔር አንተ የሰው ወዳጅ ነህና አቤቱ የተፈታን ነፃን የወጣን አድርገን። ወገኖችን ሁሉ ብላቸው አድነኝ መሆንን ባሪያን ሰጣን። ክቡር የሚሆን ፓትርያርካችን አባ ጳውሎስን ሊቀ ጳጳሳችን አባ ኤልሳን አስባቸው። አምላካችን ሆይ ለብዙ ዘመናትና ለረጅም ወራት በእውነትና በሰላም ጤና አስተሰርይልን። ሴቶችን ባሮችን ከበደልን ከመርገምም ሁሉ አድናቸው። በቃላችን እንዲሆን በሥራችን እንዲሆን በሀሳባችን እንዲሆን አቤቱ
ቀሲስ ዳዊት በቃሉ እባላለሁ። በኢትዮጵያ ኦርቶዶክስ ተዋሕዶ ቤተክርስቲያን ልማትና ክርስቲያናዊ ተራድኦ ኮሚሽን በሰሜን ጎንደር ሀገረ ስብከት ኤችአይቪ ኤድስ መከላከያና መቆጣጠሪያ ፕሮጀክት አስተባባሪ ነኝ። ከስኮፕ ጋር የምንሰራው ዋናው ምክንያት ምንድነው? ከዚህ በፊት በኢትዮጵያ ኦርቶዶክስ ተዋሕዶ ቤተክርስቲያን በተለያየ ጊዜያት በተለያዩ አባቶች ተሰብስበው የሚገኙ ቅርሶችን በሙዚየም ለማስቀመጥ አስበን የስኮፕ ድርጅት እነዚህን ቅርሶች የገንዘብ እርዳታ አድርጎልን ሙዚየሙን አድሰን በአሁኑ ሰዓት እየተጠቀምንባቸው እንገኛለን።
My name is Meheret Endashau, and I'm an MPH student in the Department of Global Health at the University of Washington. And one of the reasons I really wanted to do public health as a career is because I grew up seeing a lot of health disparities, and I wanted to make a difference.
My name is Sophia Tashoma. I am a second-year MPH student at the University of Washington in the Community-Oriented Public Health Practice Program. So I really have a focus on public health practice in a community-based setting. I'm a first-generation American. I was born and raised in Seattle, Washington. My parents are from Ethiopia, but I retained fluency in the Amharic language.
አበረደስ ይባላለሁ። የኤምፒኤች የመጨረሻ ወይም ተመራቂ ተማሪ ነኝ። 10 ዓመት የሥራ ዘመናትን አሳልፌያለሁ እላለሁ።
The reason I applied to the Scope Fellowship is because I was really impressed by the partnership the project was able to make with the religious community and with the medical community, and I think it's really important, especially in Ethiopia, to work with religious communities and try to treat HIV patients because people are really tied to religion, and people make life and death decisions based on religious reasons or faith. HIV is not just a physical disease; it breaks down economical and social structures, and I think bringing in a really important factor of religion, people listen to into treating HIV patients and then reducing stigma is really important because, in my opinion, as an Ethiopian, one of the strongest characteristics of Ethiopia is its social cohesion, and HIV is one of those diseases that's been able to destroy that, and I think it's really important.
I applied for the Scope Fellowship because, first of all, I'm really inspired by this unique approach that they're taking. The collaboration between the Ethiopian Orthodox Church and the medical communities is just really phenomenal. The Ethiopian Orthodox Church has been an untapped resource, I could say. About 50% of the population is Orthodox, but here in Gondar, more than 85% of the population is Orthodox Christian. So the church has extreme influence, very widespread influence in the community. People are very deeply religious, and many times are more willing to listen to their priests or monks or the people from their church than they will from government officials or doctors or other medical personnel. And I think that Scope has really great potential to deliver culturally based, appropriate care to the community.
በነበረኝ የሥራ ጊዜ የሥራ ዘመናት በተለያዩ የሥራ ቦታዎች በመመደብ አገልግሎት ሲሰጥ ቆይቻለሁ። ከዚህም ውስጥ ዋና ዋናዎችን ለመጥቀስ ያክል በጎንደር ዩኒቨርሲቲ ሆስፒታል የውስጥ ደዌ ሕክምና ክፍል የኤችአይቪ ኤድስ በሽተኞችን የቲቪ በሽተኞችና ሌሎች የውስጥ ደዌ በሽታ ያለባቸው ሰዎችን በመንከባከብ እንክብካቤ በማድረግ በማከምና የጤና ትምህርት በመስጠት ሳገለግል ቆይቻለሁ።
Specifically, my project is focused on factors that influence depression, such as lack of social support or stigma. A previous Scope Fellow has identified soul fathers. There are special priests as people, religious leaders that can really make an impact in terms of adherence. In trying to train these special priests to look at all the factors that affect a patient's adherence to medication, and how these priests can be involved in treating that is really important.
Recently, the North Gondar Diocese requested that Scope help them to implement an HIV clinic within their compound. So I've come to Ethiopia to do an evaluation, a feasibility study and assessment of this clinic, because it's a quite novel idea to involve religious leaders in clinical care. I think that the church could potentially be very effective at breaking the cycle of stigma and discrimination, and working on care and support issues, as well as working on the clinic.
Activities ማድረግ ያስፈልጋል። ቅድመ ስልጠና አክቲቪቲዎች አሉ። ቅድመ ስልጠና እንቅስቃሴዎችና በስልጠና ጊዜ የሚደረጉ ሌሎች እንቅስቃሴዎችና አክቲቪቲዎችና ከስልጠና በኋላ
One of the most surprising things for me is how early religious socialization begins. One day we were walking by a church and we saw a priest walk by, and there was a group of kids. There were maybe like 2, can't be more than 3. They were playing on the ground, and the minute they saw the priest, they all stood up to kiss the cross. So this kind of reiterated the fact that religious is a really important component of this community, and that we need to work with them in order to give better treatment for patients in HIV and also in mental health, which is what I'm also very interested in. So thank you.
The church is just extremely influential. I've already interviewed many people, and there is absolute 100% agreement that the Ethiopian Orthodox Church is a very influential, probably the most influential community institution there is.
ነገር ግን አሁን እንደምንሰማ ከሆነ በቤተ ክርስቲያን ለምሳሌ ወልሸት ገብርኤል አርሴማ ምናምን ተፈወስን ድነናል ምናምን ይላሉ እና እንዴት ሊፈወሱ ቻሉ ማለት ነው?
ይህ ማንኛውም ሰው ሲጠይቀው እንግዲህ ያው እንደ ማንኛውም ሃይማኖት ማለት እንደ ሁሉም ሃይማኖት እመን ይደረግላል። ይህ እንግዲህ መፈወሱ ሁላችሁ ሄዳችሁ ማየት ትችላላችሁ ማለት ነው፣ ስለመፈወሳቸው። ምክንያቱም በመጀመሪያ ደረጃ ፖዘቲቭ ተባሉ ወይም ደግሞ ቫይረሱ በደማችሁ አለባችሁ ተባሉ። ከዛ በኋላ ደግሞ ጸሎት ሲጠመቁ ኔጌቲቭ ተባሉ፣ የለባችሁ ተባሉ ማለት ይሄ እግዚአብሔር አምላክ ወይም ደግሞ በየእምነታችን የሚሳነው ነገር አለ ለእግዚአብሔር ማለት ነው። የሚሳነው ነገር የለም። ከዚህ በፊትም እኮ በዚህ ዓለም በነበረበት ጊዜ ወደዚህ ዓለም በመጣበት ጊዜ እኮ ብዙ ድውያንን ማመን ሙታንን አስነስቷል፣ ሕሙማንን ፈውሷል፣ ድውያንን ፈውሷል።
አውጡንና ዲያቆናቱን አጥራቢዎችና መዘምራኑን